Assalamu alaikum dear friends. Today I'm going to talk about the antihistamine or histamine receptor blocker. So in the previous video I have already talked about the histamine and the histamine production, their synthesis and release of the histamine, and the histamine receptor function when it is activated by the histamine. So now I'm going to talk about the histamine receptor blocker. So I have already talked about that there are H1 and H2 receptor are abundant in the body. So there are only H1 and H2 blocker are present. So the H1 receptor blocker is further divided into first generation, and second generation H1 blocker. Second generation H1 blockers. So the first generation H1 blocker are older. They are older and inexpensive. And they are effective as compared to second generation. So they are mostly used, and they are also lipid soluble, so it can cross the blood-brain barrier and can enter into the CNS, where it can act on the cortical H1 receptor, and it also blocks the cholinergic receptor, so it causes sedation. So the first generation H1 blocker, the first generation H1 blocker causes sedation, while the second generation H1 blocker doesn't produce any sedation. So the first generation H1 blocker drugs include the diphenhydramine, chlorpheniramine, clemastine, diphenhydramine, promethazine, cyclazine, maclazine, hydroxyzine, and the doxylamine. So these are the first generation H1 blocker. Antihistamine are used to prevent the symptom rather than reversing them. First generation blocker are not H1. They are not H1 selective. They also act on another receptors like cholinergic receptor, serotonin receptor, act on the adrenergic receptor and blocking them. So the first generation have more adverse effect than the second generation. So now I'm going to explain the second generation H1 blocker. Second generation H1 blocker. The second generation H1 blocker water soluble. They are formed by the addition of the carboxyl group, and they cannot cross the blood-brain barrier, so they act mainly peripherally and cannot produce any sedation. So the drugs that are included in the second generation are the cetirizine. Cetirizine is the carboxylated form of the hydroxyzine, cetirizine, levcetirizine, loratadine, loratadine, desloratadine, desloratadine, and fexofenadine. The second generation are not so effective as compared to the first generation, so the first generation are more frequently used. So these are the drug included in the second generation. They include the second generation include the cetirizine, levcetirizine, loratadine, desloratadine, and fexofenadine. So the H2 blocker mainly act on the parietal cell of the stomach. I have already talked about this in the previous video. Parietal cell and blocking the H2 receptor. So when histamine act on the H2 receptor, it will produce the gastric acid. So when the H2 receptor are blocked by the H2 receptor blocker, it will prevent the secretion of the gastric acid. So the drugs that are included in the H2 receptor blocker are the famotidine, cimetidine, nazatidine. So these are the drugs that are included in the H2. So in this video, I have talked about the H1 and H2 receptor blocker. The H1 receptor blocker are further divided into first generation and second generation. The first generation drugs are older and they are inexpensive, and they are more effective. So they are frequently used. And they are lipid soluble. They can cross the blood-brain barrier where it act on the cortical receptor and also block the cholinergic receptor, so it produce sedation. The first generation drugs include diphenhydramine, chlorpheniramine, clemastine, diphenhydramine, promethazine, cyclazine, meclazine, hydroxyzine, and daxalamine, and other drugs are also included in the first generation. The first generation not only block the H1 receptor, but it also block the cholinergic receptor, serotonin receptor, and adrenergic receptor. So the adverse effects are more frequently associated with the first generation. So the second generation H1 blocker included the cetirizine, the levcetirizine, loratadine, desloratadine, and fexofenadine. The second generation are less frequently used as compared to the first generation because they are ineffective and they work mainly in the periphery of the body, and that doesn't produce any sedation. The H2 receptor blocker act on the parietal cell where they inhibit the production of the gastric acid. So they are mostly used in the ulcer. So the drugs that are included in the H2 receptor blocker include the famotidine, cimetidine, nazatidine. There is another drug called ranitidine. So these four drugs are included in the H2 receptor blocker. So this was all about the H1 and H2 receptor blocker. So thanks for watching the video.